Hello and welcome to the Parkinson's Foundation Wellness Wednesdays webinar. The Parkinson's Foundation is a nonprofit focused on bettering the lives of those living with Parkinson's through improving care and advancing research. Importantly, everything we do is in close concert with our community to ensure that our actions are aligned with the needs and priorities of those living with PD. Most people with Parkinson's disease will experience changes in speech and voice at some point during the course of the disease. Today, we will learn tools and exercises to help us better understand and manage speech and communication challenges in PD. We are recording today's presentation. You will receive a follow-up email with a link to today's recording and other resources in the coming days. For today, you will need a pen and paper to take some notes, and our speaker will share what we need that for as soon as she comes on. The Parkinson's Foundation provides weekly education and wellness programs virtually through our PD Health at Home series, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, our expert briefings, and our Spanish language programming, Y Salud en Casa. Join us for our next Wellness Wednesday, which will be hosted on, I believe it's January 31st, and there's a little typo there in my slide. I'd like to invite you to join us this Friday for our live Fitness Friday session. Maintain a step ahead with the PD Connect Basics program, a multifunctional class focusing on balance, aerobics, strength, integration, and excellence. The goal is for moderate to vigorous intensity with modifications in standing and in the chair. You can sign up to attend the live stream at parkinson.org/pdhealth. To begin our formal presentation, we'd like to introduce today's expert presenter. Darla Freeman is a speech-language pathologist who's been treating Parkinson's patients for over 25 years. She earned her doctorate degree from Northwestern University with a research focus on factors influencing successful behavior changes in adult intervention. Since 2016, she has served on the Parkinson's Foundation's team training faculty. Currently, she treats PD patients at the Florida Center for Voice and Swallowing in Tampa, Florida, where she is a scope specialist offering state-of-the-art voice and swallowing evaluations and evidence-based treatment. Darla, thank you for joining us today.
And thank you for having me. Okay, just going to share my screen here, everyone. Well, it looks like I'm saying good afternoon and good morning to some. I will be talking to you today about changes in speech and voice. And as Krista has shared, I work with the Parkinson's Foundation team training since 2016. And I first started my interest in Parkinson's disease a long time ago, but took a deeper dive as I worked as a clinical instructor at the University of South Florida. These are my disclosures. I have none relevant to this presentation, but may mention some off-label and investigational products. So by the time you leave today and you click off your computers, I want you to walk away with understanding voice and speech changes in people with Parkinson's, and as well to learn strategies on how to manage voice and speech changes. I wanted to start the presentation with, who are we? Who's a speech language pathologist? And you may have heard other words, is a speech therapist. No, you come to speech therapy with a speech language pathologist. So let's learn about how we get to that journey of becoming what I call a communication expert. Our first step is to earn a master's degree from an accredited university, and our accrediting body is the American Speech Language Hearing Association. Then we have a large test called the Praxis exam, which we must pass, and then we will participate in a 9-month supervised clinical fellowship And that will allow us to apply for and obtain our state licensure. So our state licensure, we don't have reciprocity. With a few states we do, but in general, you will get a license for the state you work in. And then we apply for our Cs. So when you see the credentials of a speech pathologist, you might see CCC, and that stands for Certificate of Clinical Competence. And we have two advanced degrees. We have the Doctorate of Philosophy, and we have the Doctorate of Speech Language Pathology. So what do we do and who do we treat? Well, our role is we encompass from birth, babies or newborns, through adults and end of life. We work on securing that a patient can communicate, focusing on articulation, which are speech sounds, language skills, pragmatics or social communication, voice quality, fluency, which we know as well as stuttering. We work with cognitive communication abilities and feeding as well as swallowing skills. Where will you find a speech language pathologist? Well, we work in many different areas, educational areas such as universities, preschool, early intervention. We also work in the healthcare industry, hospitals, rehabilitation centers, home health, long-term care. We work in private practice settings, corporations, public health department, armed forces, and we also provide telehealth or telepractice. And when we specifically talk about Parkinson's patients, what are we trying to do? Our goal is to maintain communication skills and to maintain safe swallowing. For the purposes of today's presentation, we will mainly be talking about speech and voice. And when you meet with us, you're thinking, well, why am I coming to speech therapy? What would be the objective of seeing the profession of speech language pathology? Well, first, we want to improve your speech intelligibility. And by doing so, we're working to increase your awareness of all the aspects of speech that may complicate your communication. We want to provide you with guidelines for yourself and for your caregivers. And the way we'll do this is to facilitate communication within your community and with your family. We additionally want to improve your speech capacity. We'll provide intensive therapy, also home practice, and this will help you to automate the systems that are involved in your communication. So what happens when communication meets Parkinson's disease? What do we know about it? Well, we know that up to 89% of people with Parkinson's will experience some type of communication difficulty over the lifespan of the disease. It can occur at any stage, and as a matter of fact, it can be the initial symptom for Parkinson's. And we know that it impacts the quality of life. I want to dive a little bit more into how communication actually works so you can understand where the breakdown happens. So this shows us just the normal systems involved in communication. We have the respiratory system, which involves the use of your diaphragm, your lungs, and it really also involves your chest, your back, and your abdominal region. And the impact that the changes of Parkinson's disease may have on the respiratory system is having shallow breathing, and that's mainly due from having poor posture. Now, as we move the airstream up through the system, air will go up through your trachea or your windpipe, and at the very top sits your vocal tract or your larynx. So inside of the larynx, you have your vocal folds or vocal cords. And we call this the phonatory system because it really just creates a buzz. Now, if you said the sound and everybody on this call did the same thing, we would relatively sound the same. Okay, but how can that be impacted by Parkinson's? Well, you could have vocal fold atrophy. What that means is the tension of the vocal folds may be less. Therefore, the vocal folds may not be able to come together and touch. And this is something that needs to occur in order for the sound signal to be strong and to be heard. So now let's review. We said we have the breath support, then it moves up through your windpipe, and then your vocal folds are there and the vocal folds begin to vibrate. So you're wondering, how do I sound like me? Why do I sound different than someone else if the buzz off of the vocal folds is relatively the same in everyone else? It's because we shape that sound using our resonatory system. That means you're using your lips, your teeth, your tongue, and your palate to take the sound that comes off the vocal folds to create a sound, a word, communication. How does Parkinson's disease impact your resonatory system? Well, something known as hypokinetic dysarthria. Hypo, reduced, kinetic, movement, dysarthria, a discoordination of our speech production. What are these specific characteristics when you have a voice and speech change? First, you may have a low voice volume. So I'm going to be asking you to kind of think back to that previous slide, and I'll also give you reminders that low voice volume is coming from two sources, and that is not having enough airflow, and then the inability of the vocal folds to come together when you're speaking. Then we have another feature, which is called hypoprosody, reduced prosodic pitch inflection. So what that means, if you're listening to me, I have prosody in my voice. I'm going up and down, like hello, good morning, how are you? And that's something that can be reduced because to make pitch changes, your vocal folds have to have a dynamic movement, and that may also change. Now, the specific voice quality changes are having maybe a harsh and breathy voice. Your voice may sound rough or sound like it says glottal fry, like that. Or it may be hyperfunctional. What hyperfunctional means is that because the vocal folds aren't coming together, you may have to strain or push to make them come together. Sometimes there is an accompanying voice tremor, which sounds like the voice is a little shaky. And then, as I spoke about before, in the resonatory system, you have hypokinetic articulation. This is happening because there's a reduced range of movement of your articulators, your lips, your teeth, your tongue, your jaw, might be some reduced range of motion. And then that will then end with having slurred speech because you don't have those strict and very tight connectors of the articulators. Now, there are other factors impacting communication, and this includes hypomimia, and this is decreased speed and coordination of the muscles of the face, and this reduces the accuracy of facial expressions and emotions. We also have speech freezing, where the jaw, the tongue, and the lips may freeze and stop a person from initiating speech, although you fully know what you want to say. And the stooped posture, that will impair the full respiration, which is the power source for vocal fold movement. And then we have decreased cognitive and language skills. Processing information and decreased word finding make it difficult for us to formulate our thoughts to convey. So you have all these different systems that need to work together. And the last thing is hard of hearing. Now, I'm not talking selective hearing. I'm talking true hard of hearing. And so when you have decreased hearing, it impacts something called your lumbar effect. And we will talk about that a little bit later in the presentation. So I'd like to take a dive into treatment, what I call the meat and potatoes of today's webinar, what you're waiting on. How can I work to better improve my communication? Well, when you come see a speech pathologist, we are going to establish functional goals for you. And how do we do that? Well, first, we're going to thoroughly assess your speech and communication skills. And we're going to use those results to make our treatment goals. But not only are we going to use those results, we're also going to be using functional goals. That means, what is it that you would like to achieve from the person with Parkinson's perspective? We want our goals to relate to daily functional activities. We want them to be able to be measurable and time specific, because this will allow us to capture the necessary data to know where we need to make changes and how well you are progressing in your treatment. But ultimately, we want to make sure that the prognosis for these goals that we develop are ones that can be obtained. So when I'm thinking about what goals I'm going to make for my patient, again, that I'm using the assessment and that they're functional, I have to go to evidence, right? We have to have evidence-based treatment. So my source is the American Speech Language Hearing Association, who has established an evidence-based map basically for us to follow. So when we think about evidence-based practice, it is the integration of clinical expertise or expert opinion, internal and external evidence, and our client, patient, or caregiver perspective. So when we talk about the clinical expertise, we want to know that the knowledge, the judgment, and critical reasoning acquired through our training and professional experiences is being put to use, and that we're understanding what we are going to do. Our evidence is the best available information that we are able to gather from scientific literature and from data and observations collected on you as our patient. And then we're going to look at your perspective. This is the unique set of personal and cultural circumstances, your values, your priorities, and your expectations that you provide for us in regards to how you want to improve your communication. So I want to talk about some of the more familiar approaches to working with voice, speech, and overall communication. We have two programs that have good evidence. The first is the LSVT approach, which is Think Loud. Now, this started back in the 1990s, and it does have the best evidence available to support better prognosis and outcomes for working with speech and communication. Then the Speak Out, which is Living with Intent. This is what I call the new kid on the block. They do have some evidential support. It's still growing in its evidence. And then we have traditional speech therapy. And this is going to be your lowest level, but it does have evidence that says from a professional standpoint, that the strategies we teach you do work. So let's go ahead and take a little dive into all of these approaches. Starting with LSVT, on the left you see Dr. Lorraine Romick. She is the founder of LSVT, and the co-founder is Dr. Cynthia Fox. They have coined their organization as LSVT Global, and this is where you'll find LSVT Loud, and the physical therapy cohort to that is LSVT Big. So sometimes you might hear LSVT Big and Loud. So again, we know that this is an evidence-based program, and they really built their platform on us understanding that loudness functions as a single motor organizing theme, which enhances overall speech. So I usually tell people, I want you to think about, what has to happen when you get loud. And if you kind of do that right now, you'll notice that you've taken a nice deep breath, and then you go to get loud. So you can understand there where this single motor function, someone just asking you to speak loud, can then change all the functions of each of the systems of voice and speech production. LSVT offers a very intensive mode of administration, and that is essential for you to maintain optimum treatment results. And if we incorporate the sensory awareness into our training, you will begin to feel more comfortable about using your louder voice. Because it is louder, it's going to be a little bit different for you. So what is LSVT composed of? Well, you would meet with a speech language pathologist approximately 4 days per week, and that can be different platforms. We do prefer in person, and you can also do this via telehealth. Your sessions should be 1 hour each. And what you'll do as the general daily tasks is you will say the sound loud for 15 times, as long as you comfortably can. And then you'll do directional movements. That means going up on a pitch glide and coming back down on a glide. And then the last are functional movements. And this is where your speech language pathologist and yourself will come up with 10 functional phrases. It might be good morning, I need water, how are you, etc. And these would be the general tasks. And then the hierarchy improves more to conversation as you continue with the program. Our next program is the Speak Out program, and they say this is living with intent. This was developed by Samantha Alandry. She's a master's level speech language pathologist out of Richland, Texas, and this is done through the generosity of the Parkinson's Voice Project. Now let's look at what Speak Out does so we can see the difference between the two programs. This focuses on you using intent to improve your speech. So think about when you say something with intent. If I said, come here, that's not really with a lot of intent. But if I mean it, I'm going to say, come here. And so you can see my articulation, my range of motion changes, the way it sounds changes as well. Now, in this therapy, it typically consists of 12 sessions over a course of 4 weeks, and this will depend on your need. The sessions consist of 6 therapy components. You'll have a warm-up, you're doing a sustained you're doing the glides, you'll be counting like 1, 2, 3, you'll take a break, 4, 5, 6, and etc. And there's reading, and then there are cognitive linguistic exercises embedded into this program, such as if I said to you, name as many pieces of furniture as you can, then you would do that. Or if I said fill in the blank, up and you'll do that. So this again comes with a workbook, and you will work through that workbook at home as well as with your speech pathologist. And this is both offered in person and through telehealth. Now, one thing that I didn't mention in my slides is that both of these programs have accompanying groups. So once you graduate from LSVT and you graduate from Speak Out, you do have the potential to join one of their groups. And I believe those are both virtual, because I don't hold groups, but it'll be virtual as well as in person. So I want you to now be able to visualize what it means to speak loudly or to speak with intent. Now, although both of these productions, and let me just back this up a little bit, this is a video stroboscopy assessment that I completed, I think last week actually, with one of my Parkinson's new patients. And she had already went through the Speak Out program. And so when I did the assessment, I first did not cue her, and then I cued her. Now, although both of these productions were over 80 decibels, so that's plenty loudness. You know, usually in our typical therapy, we want people to be about 75 decibels. But I asked her to say the sound E as loud as she could. I want you to notice the changes here. So the arrow shows you where the vocal folds are. But if you look on the other picture on the right, you can see the full length of the vocal folds, where when I did not cue her to be loud or speak it with intent, she had a little bit of tension. So that means she was squeezing a little bit, right? So then in the next photo, when I said to her, now I want you to speak loudly with intent, or speak loud, speak with a big voice, she was able to take in a deep breath, and you can see the vocal folds come together nicely, and there's little tension. So this demonstrates for us the importance of good respiratory support. So now we're going to watch a couple of perspectives from some of my patients about voice and speech therapy.
Rob, from your perspective, please discuss your experiences with LSVT Loud and the Speak Out program.
I think with the LSVT Loud, it's kind of jumpstarts you into the program, and you get immediate feedback on how you're doing the instrumentation that they have here. I find that very helpful and very competitive. I like to look at it and I can't wait till I can beat that number. And that's helped me with my therapy. The speaking out program has a little more flexibility on when you come in. But I like the way it's structured with the handbook. It's very good. And you can do as much as little as any session.
Can you share something specifically that you like about both of those programs?
Well, if you get results, you can see the results. And that it keeps motivation up for you to keep working at it.
What advice would you give to someone who is seeking voice therapy?
Well, don't hesitate and go ahead and get it. Even if you think you're doing well, the problem is that what you hear in your head is much louder than than the person that you're speaking to can detect. So you have to almost scream to get your message out, and so that your person listening to you can decode it.
And my last question for you, Rob, when do you think is the best time to begin speech therapy?
Well, if you have Parkinson's disease, probably going to need it as soon as you're diagnosed. And speech pathologist is part of the overall team. And your neurologist is a quarterback. And important to get that. And this physical therapy and occupational therapy. Parkinson's is progressive, and you're gonna need to help put things down. Now, I've been diagnosed for over 14 years, and this certainly been a good adjunct to the other therapies that I've had.
Thank you. Hello?
How are you?
I'm doing well today, and thank you for participating in speaking with us.
Not a problem.
Can you share when you were diagnosed with Parkinson's?
In 2007.
Okay, and do you have any communication problems at all?
I don't speak out enough for the people in my environment. They're always telling me either speak up or they'll tell me enunciate. And there is on the part of my enunciation that does get worse with fatigue. But
Okay, and have you ever went to speech therapy for your communication?
I did the LSVT loud program and also speak with intent. I think that was called. I got good results from both of them. The problem with me is that I need to stay focused and keep doing it and not let it go.
And when would you tell others who have Parkinson's to see a speech therapist or a speech language pathologist?
I think before things change, just to get a baseline, so you can follow what's going on. But I remember when I was first diagnosed, I got so much information about what exercises I should do. Was it surfing? Is it boxing? Is it whatever? I was bombarded by what we needed to do physically. Nobody mentioned the speech until things started changing. So,
well, I thank you so much for your information. Is there anything you'd like to share with others about communication and Parkinson's?
I guess the big thing would be expect it. Because like I said, there's so many other different things that are going on with your body. It really seems like it is a whole body disease. Just so that you have your guard up, expect it.
Well, thank you very much. We
You're
really
welcome.
appreciate you.
No, take care.
Okay, so we've talked about two programs, LSVT Loud and Speak Out, which have our highest levels of evidence. Now we're going to talk about a traditional approach to treating speech and language problems and voice problems with Parkinson's. First, so what are some compensatory strategies? Things that you can do every day, be mindful of them. I would say the challenge with compensatory strategies is maybe that language cognitive barrier, because you have to remember these things. That means there's an internal focus. What we know with Parkinson's is that internally, because of the changes to your brain and thinking, that can be challenging. So you may want to use some of these strategies, but have them as an external. So what I mean by that is maybe having a little sticky note that reminds you, or maybe your care partner helping to remind you to do some of these strategies. So let's look at this list. Slowing down the rate of your speech, using more breath that will help you speak louder, being sure that you're articulating by moving your lips and your tongue. That'll give you good articulatory precision. Say sounds as clearly as you can within words as well as sentences. And if you have the fine motor ability, try doing different things like gestures, writing, using your computer, even text messaging using your cell phone. Make sure your posture is good. Look at a person directly in their face. Keep your chin up and focus on big, loud sounds and slow, short phrases. Now, when we bring in our caregivers, because they are very important and we need to train them on how to make or help communication be more effective. So you'll see that there's this gradual shift as the disease progresses towards there being some more responsibility on the caregiver. So the strategies that we would help and assist to train our caregivers are controlling the communication environment. We want an environment that's quiet, that's very conducive to communication, not a lot of distractions. Watch and attend to the speaker, because as the care partner, you want to make sure that you're watching their lips. You're doing things like asking questions because you want to clarify what your loved one is saying. You want to ask for the topic. Are we talking about, are we talking about your next doctor's appointment? Are we talking about your medications? Are we talking about what's going on with the kids in school, or what's going on with our grandchildren, etc. And you want to make sure to repeat parts of the message that you did understand, because this really builds confidence in the communication, instead of saying, oh, I didn't know what you said, and I didn't get that. Just say, what I understand is you're asking me about what time to take your medication. Okay. This one's pretty big, and that's advocating for inclusion. What happens when speech and voice deteriorate or they become worse? We have a tendency to want to exclude people from conversations, right? We want to make sure that we're including our patients or people with Parkinson's. So how do we do that? Well, make social inclusion happen. Make it happen, even if it's minimal participation, making sure that they're being included in on the conversation, and that they feel that they're being included in on the conversation. If there's any hearing impairments, making adaptations for that. Certain things like making sure the hearing aid is turned on, making sure the hearing aid is working properly, being in an area maybe that doesn't have a lot of background noise. Try to stick to small group settings and pair your speech and with gestures. So if you're trying to say, okay, it might be something like okay, or shaking your head, okay, or shaking your head, no. Just pairing that helps with the inclusivity in a conversation. I've already talked about reducing those distractions, making sure maintaining topic, because this is where the language and the cognitive overlay may come into being a challenge. Because if you switch topics too frequently, that information may not be processed. And that's when you would be making the accommodation for what we call bradykaphrenia, which is the slowness in thinking. I use this slide all the time because I was also a grant recipient through the Parkinson's Foundation, and I started a treble clef choir. And one of my choir members, you know, when she's just so artistic, and she drew this for us, and it says, "Fighting Parkinson's one song at a time." This type of treatment is choral singing. And why choral singing is so beneficial is because it's just so predictable. The predictable lyrics helps with word retrieval, and that helps make speech just so much easier because you don't have to think about it. The melodic contour is very similar to the prosody that we have in speech, and it has that strong associative component. So it really promotes imagery. And, you know, when we see things that are imagery, it's kind of the music, the flow, it helps with the prosody. It promotes a community bond and reduces the feelings of loneliness. It releases serotonin and oxytocin, which helps you to relieve anxiety and stress, and it leads to a feeling of just trust and bonding. And it reduces levels of cortisol as well, and that's another way to lower stress. Another traditional approach to treatment is by using tools and by using apps. And so I want to go into a few of those. This is called the Speech Vive device. It's based on research done by Dr. Jessica Huber, who is a PhD level speech language pathologist. It has NIH funding and research to support its efficacy. With the use of this device, you can have immediate improvement in your volume and your speech intelligibility. And in some instances, it can carry over to improvement without even using the device. And I have seen that patients put the device on, their speech will improve. They can take it off and kind of just still self-monitor and be able to get that connection and have good communication. Unlike devices that use a white noise, pink noise masking, there's no indication of desensitization to what we call multi-speaker babble. So this device works on the multi-speaker babble instead of like a noise masking. And so I have a little sample here, and just to explain to you what's happening is that when this multi-babble speaker is heard through the person's ear, they do what's called the lumbar effect. And I mentioned that at the very beginning of this webinar, and that I would come back to it. So the lumbar effect means when we hear sounds, we automatically speak up. Why? Because we need to hear ourselves. That's how we regulate ourselves. So in order to hear yourself, you have to speak up over this multi-babble sound, and that will initiate your lumbar effect. So let me see if I can, I don't think that's going to work for me on here. Oh, there we go. See if it will play for me. I don't think it's going to give it to me. What it sounds like is like a noisy party. You can like hear people mumbling in the background, and then you speak up over that sound. Sorry about that little technology mix up. Okay, another program is a Speak Up for Parkinson's. I use this on my iPad. This is a free app, and it allows you to video record yourself saying words or saying phrases, reading aloud, or even having a conversation. It has a volume target zone, and this zone will turn green when you're loud enough and you reach the targeted goal. The downside, though, of this app is that you do really have to speak very loud to reach that green target zone. However, it really is good for encouragement, encouraging you to increase your vocal effort. There is a video recording component of it, and then that way you can look at yourself back and hear, was I good with my articulation? How was my intelligibility? And how was my facial movement? So it helps you to self-monitor, self-reflect, self-change. Sound pressure level meters. Most people enrolled in LSVT or Speak Out will be asked to download on their phone, their iPad, a decibel meter, because this can help you, again, see if you're in your targeted zone. So if you're set at conversation at 72 decibels, you can put your phone up, set it across from you, and talk. And a lot of times we use these for telepractice as well. So good things to have. So in summary, there are several benefits to speech therapy. One, we are helping you to regain and have the best postural control that you can. We will help to improve respiration by improving the coordination of breathing, making efficient use of exhalation when speaking. We'll help to maximize muscle use and muscle function by means of your lips, tongue, and jaw. And we'll help with pronunciation and rhythm of speech. We'll help with laryngeal function, predominantly with your vocal folds, as well as prosody, which is intonation. Now, at the beginning of this presentation, Krista had alerted you that you need paper and pencil. So I'd like you to take a moment to get paper and pencil. We're just going to do a couple of interactive tasks to finish out. Looks like we may have about a little under 10 minutes to do that. So I want to talk to you about patient-reported outcomes. This is a part of our assessment. Remember, I said that I like for our goals to be functional, right? And so functional means we need to get an idea of where you're having difficulty. So this is a rating scale that we use, and this VHI stands for Voice Handicap Index. Now, this is a smaller version. The original one has 3 different sections with 10 questions each. This one just has 10 statements. And what I'd like you to do, I'll read each of the statements, and I would like for you to rate that on a scale from 0 to 4. So 0, obviously, here is never. 1, almost never. 2 is sometimes. 3, almost always. And 4 is always. Okay. My voice makes it difficult for people to hear me. And just jot that number down. The second one, I run out of air when I talk. Number 3, people have difficulty understanding me in a noisy room. The fourth one, the sound of my voice varies throughout the day. The next one, my family has difficulty hearing me when I call them throughout the house. Number 6, I use the phone less often than I would like to. Number 7, I'm tense when talking to others because of my voice. The next one, I tend to avoid groups of people because of my voice. Number 9, people seem irritated with my voice. And the last one, people ask, what's wrong with your voice? Now, what I'd like you to do is add those scores up. And for those of you that are savvy with the chat feature, if you could just put your number in there so we can see what some responses are. Two 18, 4. Thank you, Joseph, Martha, Deborah, Bob, Larry, Gordon, Tom, Linda, Doug, Gary. Thank you all. Bill, thank you. Richard, Stephen, Fred, Teresa. You know, I can't read this fast. Thank you all for putting your numbers in there. It's a great numbers. Claire, I like that you're at 0 still. 19, 21, 24. We're getting some great numbers in here. Okay, so just keep adding your numbers and I'll let you know that a score greater than 11 indicates to us that you are having a communication disorder related to voice. And just by some of these questions that you've asked, like people ask, what's wrong with your voice? This is something that we may perhaps educate you on how to talk to people about having Parkinson's. I use the phone less often. That may be a goal that we actually work on in treatment. You being able to either FaceTime or call someone on the phone using your loud voice, using your voice with intent, or using one of your strategies. Okay. And then let's see here. Okay. So now what I'd like to do, and we have maybe like a couple minutes, I just have a couple more slides, that this is how we help you to develop your goals. We want to look at situations where you want to communicate well, and we want to look at your everyday speaking situations, who, when, or what. So if you'd like to share in your chat, and perhaps these are things we can talk about during our Q&A, share with us, when is it that you want to talk better, AM or PM? When is the most difficult time for you to communicate, and why? What would you like to improve? What aspects about Parkinson's disease bothers you the most? And what have you stopped doing because of Parkinson's disease? Have you stopped working? Are you finding less enjoyment out of some leisure tasks and exercises, and why? So you can share that with us, or kind of keep that thought for yourself as we go into our Q&A. I wanted to give you a slide here that talks about finding a Parkinson's disease speech language pathologist. You can reach out to the Parkinson's Foundation helpline, and that is 1-800-473-4636. You can go to the LSVT website and you would select Find LSVT Clinicians, because people who are trained in these areas or in these treatment approaches are likely those that work mainly with Parkinson's patients. And then the second one is Speak Out. If you open up the tab on Our Program, then there'll be a drop down where you can find a provider. So in closing, communication disorders can start at any point along the progress of the disease or the stage of the disease. Early assessment and early treatment are key. And don't hesitate discussing with your doctor, even if symptoms are not apparent. Thank you.
Thank you, Darla. Wow, there's so much to learn as far as the speech and voice changes in Parkinson's, and clearly with the number of community members who are present today, it's impacting our community across the world and living with Parkinson's and changing in our voice and our speech. We have an abundance of questions that are coming in and still coming through. So just want to set expectations for everyone. Some people did submit questions that Darla did answer in her presentation. Those questions I will not be asking. And we will not have time to get to every question. I'm so sorry about that, but we are limited on time. So right now at this point, I'll be proposing questions to Darla that came in, and any future questions, I encourage you to reach out to our helpline that Darla shared earlier. So Darla, I want to continue. This individual is sharing that they want to, multiple individuals, in fact, they want to encourage their spouse to stay positive through these changes, also to speak louder. So how can care partners, friends, or family members actively support individuals with Parkinson's in their communication?
We find this quite often, Krista, because even though our patients may come to therapy, it's that long-term carryover and generalization that becomes a challenge. And so I call it in my treatment kind of like the secret code. So that means, making sure that you guys have that unique private communication on how you're going to cue a person to keep loud. right? And to do some of the techniques that I talked about, like the articulating, the speaking up, the smaller phrases. I think the biggest challenge is communication changes and the way they're going to communicate will change. So it's going to be important that the communication partners around them get that, like I said, that kind of secret code to help encourage them. And also by some of the other things, like when the patient or person is talking, you're letting them know that you understand. Repeat what you heard. Repeat the good parts of the communication. It's real easy for us to, say, but I didn't understand you, and repeat that again. And then that kind of makes a person, go introvert. They don't want to communicate. So I think keeping up positivity, coming up with a communication style, right? And letting other people know about that communication style. That's a family discussion. It's like we're getting ready to go over our neighbors. Is it okay that our neighbors know our code? Right? And talking to your loved one about what is acceptable for you. Are you okay with me repeating? Are you okay with us going out to dinner? Just making sure you're securing the environment and pumping positivity about communication into them.
And Darla, just to offer some examples, what would be some tips or tools or codes that say a spouse, a partner, two partners could share between one another?
That's a good one. So I have, everybody develops their own, right? And so one of the things that I've seen people do is they kind of just do the up eye, they're giving them that eye up, or they're doing like this, or they're just watching intently, and they're letting them know, I'm ready to have communication with you. So they turn off everything. It's me and you. We're about ready to have this dialogue. Right. And the other thing is just encouraging them. You can use words. You can say, is that with intent? Speak with intent. Or, I think you can get loud. You can even use your speech pathologist name. What would Darla think? Things like that. And so I think those are just encouraging words and techniques. But my main one has been like this. I've heard people do the up or up. And so you're just getting that private code. Yeah.
Thanks for those tips. I hope some of them, some of you guys start to use them today, if not tomorrow. So Suzanne is sharing that she's lost her voice, and she's curious on how she can get her voice back. Any tips for Suzanne?
Well, Suzanne, it would just depend on what stage you are in of Parkinson's, and it really depends on what is happening with the anatomy and physiology of your vocal folds. So if it's truly that you're speaking and you're what we would call aphonic, which means A without phonia, without phonation, it may be time for you to see an ear, nose, and throat doctor just to get a full assessment. So once we get a full assessment of how the anatomy looks and what's happening with it physically and functionally, then that's where we would start. That would be our baseline. So from there, if you have vocal fold atrophy, then I would probably recommend one of the treatments, whether it's LSVT loud or intent, because that's going to help you to engage the vocal cords. So I'd start with that. Some people, which we don't have a lot of good evidence on, will get fillers, and that's like an injection to your vocal folds, and that helps with making the vocal folds come together. And I do know of some Parkinson's patients who have done that. So those are a couple of options, but I definitely would start with needing to understand what level you're at in your Parkinson's and maybe seeing an ear, nose, and throat doctor.
Great. Suzanne, I hope you're here and receiving that information from Darla. Darla, an anonymous viewer is sharing that their mother gets stuck on a word, and then when she does speak, her voice seems to vibrate. Do you know why this is happening and what they could do to assist their mom?
Okay, so one component, the change of the voice quality could be a tremor. And if it's an essential tremor, some things can help. So improving breath flow, again, if we're looking at this increasing loudness as a single sensory changing type of treatment, the more air you have when you talk, the better, because the fuel for the vocal folds is respiration. So the tremor sound comes from the vocal folds. Okay, that's the signal. So they actually may not be working regularly. So meaning how they vibrate and open, and they don't do that in a fashion that we would call periodic. Okay, so the vocal folds may go like this, 1 and 2 and 3. With the tremor, they may just change their movement. And that's going to create that sound of a tremor-like sound. Okay. Then the second part, I believe, was, and I need to have Krista reiterate that, but I believe it was the articulation. When it came out, it didn't sound clear. And that's likely the hypokinetic dysarthria. This would be the slowing down of the movements of the articulators. And this is where the precise speech movements would be very helpful. So engaging in moving the lips, the tongue, and slowing down. You know, you don't have to go through saying, I want you to move your lips better, or I want you to move your tongue better. Simply slowing down really does help. So if you try that on yourself, if I slow down, I feel like I have to say every sound of every word or it wouldn't even sound right. So those are just simple cues and things that you can work on during conversation, or if you guys just did some reading and you worked on those skills, okay? But remember, it may be beneficial if you write those out and just put them in front of your mom so she knows what she's trying to do instead of needing to combine the thinking. And I think the last thing was the speech freezing. And I talked about that a little earlier. The speech freezing can come from slow thinking. So the thought is there, but then the brain is not talking to the movement of the sound. And so one thing you can do with that one is you can stop, maybe deflect to something different, and then come back. And for those who are communicating with folks that have speech freezing, patience will be a big virtue for them, and that is just waiting and allowing them to communicate what they want to communicate. And you can also accompany that by a gesture. So they may not be able to say what they need to say, but they can try to mimic a gesture to help with the speech freezing, to accompany it as a technique.
Thanks, Darla. You know, you mentioned a point here, and several of our community members who are on live right now have shared how frustrating it is to communicate with someone who has slowed speech or producing a sentence, and reiterating that patience. And I really appreciated the slide of inclusion. So yes, it is understanding first what's happening, being patient with the production of the words and of the voice. Just wanted to touch that for our viewers here who asked multiple times about this frustration of waiting for our loved one with Parkinson's to communicate with us.
Yeah, I think, Krista, in the days of just everything coming so fast, and to be honest, how social communication is becoming less and less, right? Of people sitting down and actually having conversations and discussions, that, patience is kind of wearing thin, I think, in many different areas. So you have to be prepared. Again, knowing the topic will make a lot of difference, and not requiring long productions, short phrases, one words to get the intent across.
Yeah. Kind of rounding out our Q&A session here with a little bit more general questions. And if you have more specific inquiries about your journey with your change in voice and speech, please reach out to our helpline. We have Parkinson's specialists ready to offer you guidance and connection with resources, tools, and practitioners that can support your needs through Parkinson's. So Ron is sharing that his wife is bedbound. Curious if a speech pathologist could come to the home, or is this something that can be offered through telehealth?
Most definitely. So we do work in home health, and I'm assuming, I would think, if your loved one is bedbound, they are receiving most of their services via home health. I would think nursing, if PT was coming in, yes, speech pathologists can come in. And in that case, and I'm not for sure what level of communication she has right now, it may be at the point that you do need some type of augmentative type of communication. But, again, that just depends on fine motor skills and how she would be able to communicate. But yes, telehealth is a viable option, and home health is a viable option. number one, you want to reach out and see what your insurance company covers, but then you want to get either your primary care physician or your neurologist to write the prescription for you for speech pathology services.
Thanks, Darla. It sounds like it starts with the questions, right? Asking for
Yeah.
that referral for speech language pathology, connecting with insurance to verify it's covered, and then making that connection with a speech language pathologist to schedule.
I would like to add, though, we have to be careful because some insurance companies are offering telehealth and some are not. Since the pandemic has kind of officially been ended, some are and some are not. So just check on that.
I would love, Darla, if you could indulge us in an exercise that our viewers can do by themselves to improve speech before we close.
Yeah, most definitely. So, you can practice some of those loud ahs. Those are great. So that means I'm getting my posture good. I'm going to use my abdominal area to breathe. So I'm going to inhale. And when I inhale, I'm going to expand. And then I'm going to come out with a ah. And I'm just doing that as long as I can. And so you're using basically your chest voice, as we say, for anybody out there who's a singer. And so just practice that throughout the day. Other things, trying to read poems, or say a poem, Jack and Jill went up the hill, to kind of work on your prosody and intonation are good things to do.
Great. Thank you so much, Darla. This has been insightful, informative, inspiring, and also some playfulness. So I really admire how, you can sing these poems, these folk stories out loud to one another and really have a good time with your loved one and with yourself of just expressing through your voice. So thank you so much for your time today. I apologize, everyone, that we could not get to all of our questions for today's presentation. So please do reach out to our helpline at 1-800-4PD-INFO. And that's one of my colleagues will post that number in the chat for you. We'll see you sometime soon on the World Wide Web through PD Health at Home and future webinars. Until then, be well and be loud.